Did you know that most children will suffer an ear infection by the time they are 1 year old? If your baby or child is heading to daycare for the first time, you may want to be on the lookout for these symptoms and understand what you can do to help your child. Welcome back to our channel. If you're new here, my name is Meg Conover. I'm a physician assistant and a mom of 2 young boys. Today, we're going to talk about a very common issue that many parents face: middle ear infections, specifically acute otitis media in children. By the end of this video, you will have a better understanding of how to identify, manage, and treat ear infections in your little ones. I also want to share our personal experience with repeated ear infections and ear tubes, since we have been through this surgery 3 times with my 4-year-old son. So what exactly is acute otitis media or middle ear infections? In simple terms, it's an infection of the middle ear behind the eardrum. This condition is particularly common in children between the ages of 6 months and 3 years. It's usually caused by bacteria or viruses that enter the ear during a cold or respiratory infection. How can you tell if your child has an ear infection? Here are some key symptoms you want to watch out for. Number 1, ear pain. Your child may tug or pull at their ear. This alone is not a sign of infection. Children tug at the ear for many reasons, including body exploration and teething. If you see ear tugging, look for other symptoms as well, especially fever. Tugging with fever is more concerning for infection. Number 2, fussiness and crying. More than typical, especially when you lie them down in their crib. Number 3, difficulty sleeping due to the pain when lying down. Number 4, fever, a temperature of 100.5 Fahrenheit or higher. Number 5, fluid drainage. This can be yellow, bloody, or clear from the ear. Number 6, hearing problems, muffled hearing or difficulty responding to sounds. Number 7, you might even see poor feeding, vomiting, and diarrhea in babies and young children. And number 8, you will typically see these symptoms associated with other cold symptoms like a runny nose, cough, congestion, or these symptoms may occur several days following a cold. If your child is suffering these symptoms, here are some home care tips to help your child feel more comfortable while waiting to see the doctor or waiting to see if the infection resolves on its own. Remember, don't wait more than 3 days. First, anti-inflammatory medications like ibuprofen or Tylenol may help. I prefer ibuprofen for ear pain. Next, warm compress. Place a warm, damp cloth over the affected ear. Although this is not proven to work in studies, sometimes the pain is so bad, it's okay to try this, especially because it won't cause any harm. Next, hydration. Ensure your child drinks plenty of fluids. Also, if your child is over 2 years old, consider elevating the head of the bed. Raise the head slightly while they sleep to reduce pressure in the ear. I like to put towels under the mattress that are folded up. Don't do this with an infant in the crib. They can get in dangerous positions. If you notice any of these symptoms, it's important to consult with a healthcare provider. While many ear infections can clear up on their own, some may require medical intervention, especially if your child is under 6 months old, symptoms are severe or persist more than 48 to 72 hours, there's fluid or discharge from the ear, especially if it's bloody, your child has a high fever, or you see signs of possible complications. This can be swelling, redness or pain behind the ear, blood coming from the ear, which can be a sign of an eardrum rupture, facial swelling, extreme tiredness, lethargy, failure to get better over 3 days, and also you might see symptoms of dizziness. It can look like difficulty walking, crawling, or grabbing objects. For repeated infections, be sure to talk to your pediatrician about whether or not referral to an ear, nose, and throat specialist is needed. Typically, if they're having 3 or more ear infections in 6 months, they should be referred, and if there's a concern for hearing loss, the specialist can further discuss any need for ear tubes and surgery. So what are the treatment options for ear infections? Depending upon the severity, your child's age, and overall health, your doctor might recommend observation. Sometimes doctors suggest waiting 48 to 72 hours to see if symptoms improve on their own. In this case, they may prescribe an antibiotic, which you don't need to start unless the symptoms get worse or the symptoms don't resolve. If symptoms improve, you may not need to take the medication. Antibiotics. For bacterial infections, especially in younger children or severe cases, usually amoxicillin, augmentin, or ceftonir, typically high dose for 10 days, are prescribed. Make sure to complete the full course. And remember, if symptoms aren't improving after 48 hours of antibiotic treatment, return to your doctor. In some cases, certain antibiotics don't work and they need to be switched to different types of antibiotics. For pain management, use over-the-counter pain pain relievers like Tylenol or ibuprofen. This can help alleviate the discomfort associated with the infection. Always follow dosage and age instructions provided by your pediatrician. I prefer ibuprofen for pain associated with ear infections in my kids and in myself. You may wonder how the doctor or provider decides what type of treatment to recommend. Here's a little bit more detailed information about what we look for. We use otoscopes to see in the eardrum and what's behind it. We examine the ear canal or outer ear to make sure that there's no infection there, such as swimmer's ear. We also look at the eardrum or tympanic membrane. We look for things like swelling, redness, increased vascular appearance, and most importantly, the fluid behind the eardrum. If the fluid behind the eardrum is clear, infection is not likely. If it's dark, green, yellow, whitish, we are more suspicious that the fluid is infected with bacteria. We recommend antibiotic treatment when this occurs to prevent worse outcomes and possible complications. Untreated bacterial ear infections can lead to these complications. Although they are quite alarming, they are usually rare, especially when treated appropriately. But the complications can include meningitis or infection of the spinal cord, bone infection of the ear or skull, sepsis, which is a severe infection that spreads throughout the body, facial nerve injuries causing irreversible facial paralysis, eardrum rupture, and permanent hearing loss. As far as prevention goes, it can be difficult. Ear infections are not contagious in and of themselves, but the virus that come before them typically are. Here are some tips that might help. Keep your child away from secondhand smoke. Maintain good hygiene. Teach your child to wash their hands with antibacterial soap regularly. This helps avoid viruses that can cause ear infections. And lastly, vaccinate. Ensure your child is up to date on vaccinations, including the flu shot and pneumococcal vaccine. These illnesses can cause secondary ear infection. There's no need to avoid swimming or flights when children have infections. Deep diving and changes in air pressure, such as on airplane flights, can cause discomfort, but won't always cause complications. We have flown with severe ear infections in my 4-year-old and he did fine. I have flown with ear infections myself and ruptured my eardrum multiple times. We can't predict who will do fine and who won't. Here's a little bit of our experience. My 4-year-old started having ear infections at about 10 months old. Since then, he's had so many repeated infections, we became concerned about how often he was needing systemic antibiotics. Our pediatrician was happy to refer us to our ear, nose, and throat specialist, who we have been working with ever since. We initially had ear tubes placed and adenoids out. That worked for about a year. Then within a year, typically a year or two, the tubes pushed their way out because of the natural healing process of the body. Then we got recurrent ear infections again. The tubes got replaced with surgery and fell out again. Most recently, for this 3rd ear tube placement, he had what's called T-tubes placed. They're a bit bigger and more sturdy, so we're hoping they last longer, maybe 2 years if we're lucky. In our experience, each time he got infections, it was after colds. There was excessive congestion and usually coughing. We would think he was better and recovered, and then all of a sudden, after symptoms went away, he'd wake up in the middle of the night screaming with ear pain, at which point we would take him into the pediatrician for treatment. He rarely had high fevers associated with his ear infections. Ibuprofen would usually work well until his antibiotics kicked in. And because he was on so much medication so often, I would give him probiotics regularly and make sure to continue them for about 2 weeks after he finished his current round of antibiotics. He recently just got his hearing retested after his 3rd surgery. Despite numerous infections and multiple surgeries, his hearing is perfect. Ear issues are not uncommon. It's important to remember that ear tubes don't prevent ear infections. What they do is allow the infected fluid behind the eardrum to drain out through the tube. We can use topical antibiotics like ear drops to treat it so he can avoid systemic antibiotics, which he would drink through his mouth that would go through his gut and can affect his gut flora. This helps avoid the need for repeated systemic antibiotics. Ear tubes have worked really well for us if they would only stay in a little bit longer. I myself had infections like he did as a child and many ruptured eardrums, and even ear tubes placed many times as an adult. Genetics is likely playing into our specific scenario. The hope is that his eustachian tubes will adjust as he grows and the infections will lessen. Per our ENT specialist, this could take even until 9 years old, or maybe, like in my case, never happen at all. Thank you for watching. I hope this video has given you valuable insights into managing ear infections in your children. Don't forget to subscribe for more child health tips. If you have any questions or experiences you'd like to share, leave them in the comments. Stay healthy and take care. I'll see you on the next one.